Using your TEZSPIRE, tezepelumab, pre-filled pen. TEZSPIRE is an add-on maintenance treatment for people aged 12 and older with severe asthma. TEZSPIRE is not a rescue medication. Do not use TEZSPIRE if you are allergic to tezepelumab or any of its ingredients. Additional important safety information will be provided in this video. This video is intended for patients who have been prescribed TEZSPIRE and their caregivers. Before using your TEZSPIRE pre-filled pen, your healthcare provider should show you or your caregiver how to use it. Please read the instructions for use for detailed information prior to each injection. This video does not replace the instructions for use. I take TEZSPIRE every 4 weeks for my severe asthma. At first, I didn't know what to expect. But now that I've made it part of my routine, I feel more confident and comfortable with the process. I keep my TEZSPIRE pre-filled pen in the refrigerator, never in the freezer. If needed, I can keep it out of the fridge at room temperature for up to 30 days, but I cannot put it back in the refrigerator once it reaches room temperature. And I have to throw it away if it's left out for longer than 30 days. Before I can inject, I have to let the pre-filled pen come to room temperature, somewhere out of reach of children and direct sunlight or other heat sources. That usually takes at least 60 minutes. Now that 60 minutes have passed, I should get the other things I need. Okay, I have my alcohol swab, some cotton balls, a bandage, a sharps container, and my TEZSPIRE pre-filled pen on a clean, safe, well-lit surface where I plan to perform my injection. So I'm ready to get started. First, I'll do a quick check. I'll look at the liquid in the medication window. It should be clear and colorless to light yellow. And the expiration date to make sure it's not expired. Great, everything looks good. Can't forget to wash my hands thoroughly with soap and water. I do my injection in a calm, quiet place where I've safely gathered all the things I'll need. That way, there isn't a lot going on around me, and I don't have to rush. I'll start by cleaning the injection site with an alcohol swab and letting my skin dry on its own. I know I can give myself TEZSPIRE in my belly or thigh. Since last month I used my thigh, I'll use my belly today. Now that I've cleaned my injection site, I'll carefully remove the cap, making sure I don't touch the needle guard, as it could start the flow of medicine. It took some practice in the beginning, but my doctor helped me learn how to inject the right way. Position, press and hold, and confirm. My doctor said I should pinch my skin first. Then I'll position the pen at a 90-degree angle with the needle guard straight towards the skin and press and hold for 15 seconds. I'll listen for the first click, which means the injection has started. I'll confirm that the viewing window is completely orange and listen for the second click, which means the injection has finished. Then I'll lift the pen straight up. That's it. Now I just need to get rid of this safely. Sometimes there's a little blood afterwards. Important safety information. Do not use TEZSPIRE if you are allergic to tezepelumab-ekko or any of its ingredients. Do not use to treat sudden breathing problems. TEZSPIRE may cause serious side effects, including allergic, hypersensitivity reactions, including anaphylaxis. Serious allergic reactions can happen after your TEZSPIRE injection. Allergic reactions can sometimes happen hours or days after you get a dose of TEZSPIRE. Call your healthcare provider or get emergency help right away if you get any of the following symptoms of an allergic reaction: rash, breathing problems, hives, red, itchy, swollen, or inflamed eyes, swelling of your face, mouth, and tongue, fainting, dizziness, feeling lightheaded. Before using TEZSPIRE, tell your healthcare provider about all of your medical conditions, including if you have ever had a severe allergic reaction, have a parasitic helminth infection, have recently received or are scheduled to receive any vaccinations. You should not receive a live vaccine if you are treated with TEZSPIRE, are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. It is not known if TEZSPIRE passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you use TEZSPIRE. Are taking prescription and over-the-counter medicines, vitamins, or herbal supplements. Do not change or stop taking your other asthma medicines unless instructed to do so by your healthcare provider. The most common side effects of TEZSPIRE include sore throat, joint and back pain. These are not all the possible side effects. What is TEZSPIRE? Approved use. TEZSPIRE is a prescription medicine used with other asthma medicines for the maintenance treatment of severe asthma in people 12 years of age and older whose asthma is not controlled with their current asthma medicine. TEZSPIRE helps prevent severe asthma attacks, exacerbations, and can improve your breathing. TEZSPIRE is not used to treat sudden breathing problems. Tell your healthcare provider if your asthma does not get better or if it gets worse after you start treatment with TEZSPIRE. It is not known if TEZSPIRE is safe and effective in children under 12 years of age. Please see full prescribing information, including patient information, at tezspire.com. For patients using TEZSPIRE at home, injection support is available online or on the phone. And for more information, you can always call your doctor. Please review the instructions for use included with your prescribed medication at tezspire.com or call 1-800-236-9933. If you have further questions, please consult your doctor. Please see full prescribing information, including patient information, at tezspire.com.